Hello, welcome to a webinar series brought to you by Purdue Healthcare Advisors. My name is George Bailey, Senior Advisor, and I'll be your facilitator for today's webinar. We'll be discussing how to build a HIPAA security program. You will learn to crawl, walk, and run through the various stages of establishing a security program designed to protect patient health information.
So let's get started. In today's webinar, I'm going to address three main topics. The first is a high-level overview of the HIPAA privacy and security rule sets. I will introduce the three stages of a HIPAA security program, and then I will discuss the initial or next steps an organization needs to take in order to get on the path to developing a HIPAA security program. Our first topic today is the privacy requirements. There are essentially 5 overarching components that organizations need to do in order to be HIPAA compliant and to ensure the privacy is maintained of patient health information. The first is to establish organizational policies and procedures to ensure confidentiality of PHI. These are your rules, your organizational policies, your required behaviors, your interactions with patients, everything that governs how we deal with protected health information, primarily in written and spoken formats, but they do extend over to the security side when we get over there. So the second is to enforce minimum necessary practices and uses when we use and disclose PHI. This is extremely important. So when we use it internally in our practices, when we share it with other covered entities, when we work with billing and other folks, only use the information that is necessary to perform the task at hand. The third, this is a rather large component of the HIPAA privacy rule set, and it basically states that we have to seek authorization from our patients every time we use or disclose data that is not for treatment, payment, or healthcare operations functions. And then when we do share or disclose data outside of a treatment, payment, and healthcare operations function, and we don't have an authorization, we have to maintain accounting and disclosure of that activity. So that if a patient were to ask, how many times did you share my data that I didn't authorize, we have to give them a report. And you have to be able to do that within a 6-year window, as far back as 2003. As of right now, it would be, 2008-9 timeframe. Fourth component is we have to communicate our organizational privacy practices and individual rights to the patient. This is typically done by means of a notice of privacy practices, that somewhat of a legal document that we post in our lobbies, we link to our webpage, we give our patients copies of these documents at many encounters, particularly on an annual basis, or certainly whenever the patient would request a copy of it. And these practices are governed by the privacy rule, but it may also include other uses that the practice uses to help treat that patient. And the last is to allow the patient and give that patient rights to review, make changes if appropriate, and access to their data. And access can be a form of paper records. Now, if you maintain an EHR or designated record sets in electronic format, you must be able to give patients an electronic copy of their records. Security rule sets. It's a little bit different, right? So we obviously still have to continue the confidentiality tenet, but now we have to maintain the integrity and the availability of protected health information as well. So the confidentiality is obviously only authorized people are allowed to see it. The integrity is that only authorized folks are allowed to change it, right? A good example would be your blood type. I'm O positive, but if I wanted the ED and at some point someone had changed it to AB and I didn't get tested for whatever reason and I needed a transfusion, it could be a rather dangerous situation. Availability, right? We obviously have to retain data for a fairly long retention period, and now that we keep things in electronic format, we have to be able to recover, right, from a data failure, data corruption, disaster recovery type situation. So data must be highly available in healthcare. We must identify and protect against reasonable anticipated threats to the security or integrity of information. A good example would be malware, right? We don't ever want a virus to infect our network, but it is something that we anticipate happening. So we install anti-malware software on, well, on practically everything that we deploy. We need to protect against reasonably anticipated impermissible uses or disclosures. So, because we have on the privacy side of the house, we have to seek authorization for every time that we disclose data that's not for a TPO. On the IT side, we have to anticipate and protect from impermissible uses and disclosures. This would be things like putting access control lists on your file shares, making sure that email is inspected and quarantined or protected if sent outside of the organization. Ensure compliance by the workforce. So what does that mean? It means that we have to monitor, we have to audit, we have to sanction, we have to train. There's lots of things we have to do to maintain IT security of the environment, but we have to make sure that our employees are following our policies, that we are able to ensure that the privacy is being maintained as well as the data security. Now that I've presented the HIPAA security requirements, let me introduce to you the various stages of the HIPAA security program. Stage 1 is you learn to crawl. This is an organization that is either HIPAA compliant or they're on their path to become HIPAA compliant. Generally, this is an organization that has an exhaustive list of HIPAA privacy and security policies and procedures. They have the accountable personnel. They train their staff on the privacy requirements, but they don't necessarily take a proactive stance of protecting data. Stage 2 is you walk, right? So this implies that you're already learned to crawl and you're building on that skill set and you're developing processes and procedures to yet be more proactive in protecting data. Stage 3 is that you run, right? So these are highly mature organizations as it relates to IT security. They have dedicated IT security operation processes, whether or not that is dedicated staff or not. It depends on the size, right? You can be an organization that can run without having extensive human capital.
Now that you've learned a little basics about the privacy security requirements, let's get into the first stage. Let's learn to crawl.
Crawling requires 5 components of this stage, and I don't want to imply that any of these things are easy to do, but once they're in place, it does make it easier to mature to the next stage. And the first item is to establish baseline privacy and security policies, right? This is a given for any HIPAA compliant organization, but the point I really want to make is that the policies and procedures need to be managed, right? These are living documents. They need to evolve over time. If you're an organization that initially developed your policies and procedures in 2003 and then again in 2005 when the respective HIPAA requirements were publicized, and you haven't looked back and tweaked them, updated them, then I would argue that you've yet to learn to crawl. Next, you need to know your systems, your network, and your data, right? These are obviously the things that we're required to protect. So knowing what they are, how they're used, all the details. We'll certainly get into more details later on in this stage. You need to develop relationships with your IT staff, right? So if you're a non-IT administrator listening to this webinar, you need to understand the issues that the IT staff have. If you're an IT person, you need to understand the pressures that a non-IT administrator has, so that when you come to the table and there's a security issue, you can discuss it, you can resolve it in a very efficient, timely manner. From an organizational perspective, you need to define what secure is, right? Being secure is a very subjective term. The security posture or security level from one organization could be completely different than another organization. I'll give you an example, right? If you're a one doc family practice, right? The security mechanisms you put in place is obviously going to be different than if you were a Department of Defense security subcontractor. So you may still have the same technology footprint, but your definition of secure would be different. And of course, we need to increase staff awareness of common IT threats. This is an area where it's a HIPAA security requirement, but a lot of organizations fail to really meet the intent of this. So let's get into policies and procedures. Policies are the who, what, where, and why, right? So, who is required to follow a policy? What is the policy meant to do? Is there a where component? So if this is a facility policy, if this is a system-specific policy, if this is maybe a data attribute, so an EHR or a file share policy, and then the most important thing that a policy statement really needs to have, and this is either be in the policy or some form of educational material that is presented along with the policy, is the why component. Not necessarily for your IT administrators. They're a stakeholder in these policies. They understand why we have these policies. It's the end users, right? They are the driving force behind protecting all your data. If you can get them on your side, if you can communicate the why, and it's a compelling message, they'll be more inclined to follow the policy, thus making it more effective, thus protecting data. And then procedures. These are the how. This is an area where a lot of organizations could use a lot of help. Right? We have policy that says, thou shalt not, or thou shall, but we don't give the how to in order to enforce or follow that policy. And then end users who aren't necessarily tech savvy, who certainly are not IT security tech savvy, they miss the point on how to follow that procedure. Policies must be communicated and acknowledged by staff. Right? This is both a training initiative. This is a liability reduction issue. Right? So if you have policies and procedures, you need to educate and train your staff on what those policies and procedures are. Procedures must be integrated, right? So you don't want necessarily different policies and procedures for the various silos of IT security. For instance, if IT operations, if your CIO is presenting the message, never share your password with anyone, but then the help desk commonly asks for a user's password in order to troubleshoot an issue, that's a mixed message, right? So we need to get on the same page, and those policies and procedures must be integrated across all functions. So know your network. This is one area that I think a lot of organizations do a very good job. So I put it in the learn to crawl stage. But to reiterate the importance of it, we need to maintain an inventory of all systems, right? So this is your desktop systems, your server class systems, any sort of vendor access systems, anything that is used to maintain, process, transmit, or store protected health information. You should know about it. In an expansion of that inventory, you need to add all your PHI repositories. So every location, whether it's a logical or physical location, of where you store PHI. And let me tell you, I will promise you this, it is not just in your EHR, right? It's in your practice management system. It's in your EHR. It's in your PACS. It's in your pharmacy system. It's likely sprinkled on your file server. It's in your email. It's in your patient portal. It's likely on removable hard drives. It's certainly on backup media. It's everywhere. But knowing where it is, common locations, so that you know, okay, we need a policy and or possibly an IT security control to help protect that area. Maintain a software inventory. Right, in the later stages, we'll talk about patch management and system updating. Well, it's hard to do that if you don't know what your software inventory is. It's kind of a timely event, but just recently, Windows XP reached its end of life. It's been around for 13 years. It was a great operating system. Do you know how many Windows XP systems you have on the network? So if you have to go to your CFO and ask for, $300,000 to replace, 250 workstations, uh, do you have that information, or would you just be guessing? You need to do a very good job of tracking infrastructure. And these are things like switches, your router, your storage infrastructure. You need to know where it is, what its function is, what operating system it's running. Are there any known vulnerabilities with that solution? And another thing you might want to think about is, what security layers do we have in our infrastructure that help protect this environment? And the last thing is within knowing your network is to getting ahead of new projects and software. Think security from the beginning and not as an add-on. Security should be a strategy. Security can't be an enabler. But if you don't know your systems, if you don't know your data, then it's very hard to think security at the onset of a project versus at the end of a project. Once we know our network, we're able to properly segment our networks. So we need to identify trusted and untrusted zones. And essentially, a trusted zone is an environment where users are essentially free to roam. And these could be your clinical workstations, environments that are highly managed, they are owned by the organization, and well maintained by IT staff. And then you have untrusted zones where it could be a mix. You could certainly have managed resources in untrusted zones, or you could have completely unmanaged, unowned resources in trusted zones. And I'll talk about that a little bit in a second, but we need to know these trusted zones so that we can properly segment our network. For instance, you wouldn't want an untrusted resource, whether that's an inpatient's laptop that they bring in to connect to your guest wireless network, getting access to your administrative network, right? If they were to plug into the wrong port and they are now magically on your trusted zone, that introduces a great deal of risk because you don't know anything about that device. It could be infected with malware, it could have a Trojan, it could it's just bad. So, in healthcare, we need to do a better job of using DMZs, right? So, and a DMZ is essentially a demilitarized zone. What it means is that anything that we don't trust, we need to put it in a segment of the network that is quarantined. It's isolated from the rest of our systems that we care very, very much about. A good example would be your public-facing web server, right? This is meant to be accessed by the public. It's not meant to generally have anything sensitive in nature on it, but if that web server were to be compromised, we wouldn't want that system, that asset, to be used as a jumping point to compromise something else within the organization. So if it's in the demilitarized zone, if it's in the DMZ, and it gets compromised, before it can attack something else in your network, it has to traverse a security gateway. It has to go through a firewall, essentially. And the firewall will say, no, you're not allowed to talk to the EHR. You have no business talking with the EHR, and that activity would not be permitted. So we do that from a network perspective, but the crawling stage, whether you can pull this off or not, you really need to start thinking about applying a segmentation to the data repositories. These are your file shares. These are your databases and clinical applications, for instance. You may not have differences, right? You may have a very flat data network where everyone has access to the same file share. But I would argue if that's the case, you likely have an issue with unauthorized disclosure of data. because not everyone in your environment has a business need to see whatever is on your file share at the given time that they're looking at it. So understand that the same way that we segment our network, you want to segment your data. So the common issues that you really need to consider when you're segmenting your network: guest Wi-Fi, vendor access, and bring your own device considerations. So your guest Wi-Fi is obvious, right? We extend this service to our patients so that we can make them more comfortable while they're in our facility. But while they're on our guest Wi-Fi, we certainly don't want them conducting anything malicious or even accidental, um, um, mischievous behavior. Think of your pediatrics ward, right? You may have some bored teenagers sitting in a hospital room somewhere, and not that they have any malicious intent, but we don't necessarily wanting them to get on certain segments of the network that we don't want them on. Vendor access. This is kind of the hybrid area. We trust these folks, right? We're paying them to provide a service to us. We likely have strong contractual agreements that indicate that they obviously need to keep their end devices secure. But again, they don't need full access to our administrative network. They need access to get their job done. So keeping that in consideration is very important. And of course, bring your own device. If you allow your staff to bring a smartphone, a tablet, possibly their own laptop to work with them, how does that device get connected to the network? You may have a network segmented specifically for that function. So segmenting your network is extremely important. And in order to mature to the various other stages of IT maturity, you really have to segment your network properly. Once you know your network, you can move on to the more soft skills, and that's developing relationships. Both IT administrators and non-IT administrators, whether that's senior management, your privacy, your compliancy, your risk management, your clinical executives, you need to develop great relationships with everyone, the data stewards, organizational stakeholders, because it's those relationships that will come time and time again and help save the day when either you need a security policy passed, or you're having a security incident, or there's an issue with enforcing policy. Again, knowing who's on the team and acting as a team is vital to crawling, but it's even more important as you mature to the other stages. And the message should be, as a team, everyone is there to help. And knowing what everyone's responsibility is within the organization and how it relates to privacy and security is very important. And of course, there's several do's and don'ts. Most of these are on the lighter side, being facetious, but all seriousness, the way to get IT on the side of non-IT folks is to, bring them donuts. Hey, I was in IT for a long time in an operational role, and I will tell you, those people that had candy dishes on their desk got a lot better service than those that didn't. That's just how it happened. But no, but seriously, don't go over IT's heads, right? There's a lot of pressures that non-IT folks don't realize, right? That we're a utility company. Do you ever call the electric company and say, "Hey, thanks, my lights worked today. I appreciate all the hard work." No, we don't think of it that way. But when you think about that, and you think about all the projects that you may have thrown IT at the last minute, thinking, "Yeah, we got a very aggressive go live on this software implementation. We need it up in 2 weeks." Well, that's very difficult for IT to pull off. In many cases, they do, but just know. So never go over their heads, unless you absolutely have to. But you work with them. Again, develop those relationships so that you can go to them. Use positive reinforcements. Did I mention donuts? Seriously, thank them when things are going well, and when things aren't going well, provide constructive feedback so that they have, they know they have someone in their corner to make things better. And this is probably the most important point I want to drive home, is if you have a new project, get it in front of IT early. You know, if you're not an IT person, if you are an RT and you want a new initiative, you know, get it in front of those stakeholders, there's data stewards early, right? Because they've got business drivers as well, and they may not have the time to discuss another IT initiative. And certainly don't beat each other with sticks. You know, we all have to play in the sandbox, so let's work as a team. Continuing on with the soft skills, an organization that is learning to crawl must also create a security-minded culture, right? The HIPAA rules require that we provide HIPAA privacy and security training to all our staff, but that doesn't necessarily equate to IT security awareness training, right? Would you be comfortable asking your user population if they understood the difference between a virus and a worm? You know, and if, or you know, would they be comfortable identifying a phishing email and a non-phishing email? These are the typical kind of threats they're going to deal with, right? They're likely not going to deal with the things that IT securities are dealing with, you know, the denial of service attacks and um, the website defacements and these other things that we have to deal with. But they will deal with day-to-day issues, right? They will get malicious email from time to time. They will get spam. They'll get phishing for sure. And if your HIPAA training modules don't address these items, then you're not crawling. Again, right, with each other as a team, we've learned that we need to use positive reinforcement. You know, I think we should incentivize security behaviors. For instance, if you walk through a clinical unit and you notice that the clinical staff are locking their screens when they're not present at their workstations, right, you should make a note of that. You know, bring it up to their manager and say, hey, you know, I want you to know that I came through the unit today and I noticed that your staff were really being diligent about screen real estate and keeping it private. And I may not get an opportunity to tell them, but I wanted to tell you so that you can relay the message onto them. If you have an opportunity to talk about these things in newsletters, right? Security awareness can be automated. It can be ran constantly and certainly can be very effective. You got to strike a balance. You don't want to inundate your end users because then it just becomes noise and they tune it out. But if it is targeted, timely, and not necessarily too regimented, then the message will get across. So think about updating banners on intranet sites. So if you have an employee portal that folks have to go to from time to time to get their paycheck or to complete their time card or to do other things, from time to time put messages up there. Articles and newsletters. So if you've got a staff newsletter, whether it's an intranet or it doesn't have to be something that you publish often. It could be a quarterly or a biannual newsletter. Put a blurb in there about, hey, you guys are doing a great job. We've had, no virus outbreaks this year. And think about rotating wallpapers on desktops. These are things that, you can do once a week or so, and it just, again, tells people to be diligent about, keeping their voices quiet, not talking about patients in elevators, those kinds of things.
See, I told you, crawling wouldn't be that hard. So now let's see what it takes to learn to walk.
There are a number of things at the walking stage that organizations need to master in order to mature to the run. It's not to say that organizations that are just crawling aren't doing some of these tasks, but in order to get to the next level, these things need to be mastered. They're on autopilot. You're getting actionable intelligence from these processes. And the one is to implement a patch management program, not only for your operating systems, but for any third-party applications. Oracle Java, Adobe Acrobat Reader, any third-party browsers you may have installed, Google Chrome and Firefox, these kinds of things that get updated almost on a weekly basis. You need to have a mechanism to get them updated. You need to develop a vulnerability analysis program, right, so that you can better inform your patch management system. You need to implement change control, depending on the size and complexity of your environment, may demand either looser or more tighter change control processes. System and application hardening, right? So if all you're doing is installing the base operating system and you haven't taken any considerations on how to better protect that system, you certainly are not walking. And then learning how to use IPS firewall and enhanced endpoint security controls, right? Better managing antivirus, better managing the host-based firewall. If a resource is leaving the facility, think about IPS and data leak prevention. These are things that make it a crawling organization a walking organization. So let's talk about patch managements. Have-nots, right? 90-day patch windows for all. No, I think you can do better than 90 days. Now, there will certainly be applications that only get patched on an annual basis. Maybe your EHR or your billing system, because those are highly available, highly sensitive applications, right? Every second of downtime that you have is critical to the organization. However, you need to have compensating controls in order to reduce the issues of not applying a security patch. Ignore vendor-supported managed solutions, right? Just because a vendor may have an asset on your network and they tell you, oh, we maintain that, don't worry about it. Well, that's not what a walking organization does. An organization that is walking knows, right? It's part of their inventory because they've identified it in their crawling stage, and they know, okay, that system is an embedded Windows XP on an EKG machine, and it doesn't have the latest update. They know that it has to be in an untrusted, secured zone because of that. If they can't patch it, they deal with it. Only include Windows or desktops. So that's also a poor practice. You need to consider at least everything in your patch management, knowing that there will be a number of exceptions that you have to deal with for an ad hoc means. Never leave patching to users, right? Setting Windows Update or the operating system to update itself and requiring users to manage that process is certainly is an appetite. It's you're prone for failure. The must. Make an effort to patch everything. There's going to be situations where you can't patch, but knowing that you can't patch, don't push it off on your vendor. Have prioritization factors, right? Things that leave a trusted zone into an untrusted zone, right? That should be something that has a higher priority than something that remains in a trusted, highly managed environment. Use tools and automation to do patch management. If you're a completely Windows environment, use WSUS, Windows Update Services, or System Center, or you can use third-party solutions like Kaseya or well, there's oodles of these, right? Spiceworks. There's lots of solutions that you can do to go out there, inventory, query the systems to let you know what systems are behind on patches. So vulnerability management, it is taking your patch management solution and then cranking up the heat a little bit, right? Because what does it do? It tries to seek out and find all your vulnerabilities on your network. Right, in order to do it correctly, you need to do the full spectrum, right? You need to do network scanning. So not just your endpoints, but you should scan and monitor vulnerabilities to your networking infrastructure, your SAN, your storage assets. All of these things have very sophisticated operating systems, and they, at times, will have vulnerabilities. You need to do credentialed patch auditing. So when I mentioned earlier that you should use automation and tools, if you do a credential patch audit, what it does is it essentially will remotely log into your resources, whether it's a Windows, whether it's a networking component like a router or a firewall switch, and it will, using local credentials for that resource, check it, and then give you a more accurate view of whether or not it's missing any patches. Configuration auditing. So if you have a policy or a standard that says, all of our Cisco routers have to have encrypted passwords. But if you're a large organization, you might have, hundreds of routers across your enterprise. How do you do that? Use an automated tool that will go out there and query your routers and determine if encrypted password stores are enabled. If they're not, put it on your list. You've got something to work on. Passive scanning. So this is essentially putting junction points in your network, whether it's at far internet location, it could be a point in your data center, that any traffic that's traversing that point in the network is passively being scanned. You take a copy of the traffic, you send it to a passive scanner, and it tells you, it starts to identify systems going through that segment of the network, and it's able to tell you, oh, you still have 14 Windows XP systems. You haven't gone out there and queried those systems directly, but because those systems are on their network and they're talking to different hosts, you're able to identify them using passive scanning techniques and know what their vulnerabilities are. And you have to send the results to the right people. For instance, if the security team is doing an audit of endpoints, so send that to the folks that deal with desktop support. Like I said earlier, don't go over their head until you've got an opportunity to work with that group directly. So if you've done a scan of the workstations and you've realized, oh my goodness, Adobe Acrobat is 5 years outdated. Before you send an email to the CIO and say, the help desk is not doing their job, send the report to them and say, hey, can you help me understand this? Is this accurate, or is it possible that we're running software that's 5 years old? It could be that there's an error and you need to debug your vulnerability analysis scanner. So hardening and change control. These are processes that, again, you could be doing them if you're crawling. It really depends on the size and complexity of your organization. But in order to be an organization that is walking, these are processes that you have to have, and they have to be quite robust. You need to develop a plan to configure and harden and keep systems secure. And keeping systems secure is, right, we've talked about it. You've inventoried them. You know where they are. You know whether or not they contain PHA, right? We've done that in the crawling stage. We now are doing a good job of patching them. We have a vulnerability analysis program that will go out there and probe these systems on a monthly or quarterly basis and give us a roadmap of how exploitable our systems are. But you need to have a system so that when you deploy a new system, then you make it a conscious effort to make that system as secure as it can be, without impacting workflow, because you still have to use that system. And this could be a standard setup procedure so that when a new desktop is deployed, you know that you've got to do these 15 things, right? You've got to turn certain things on, you got to turn certain things off, and the idea is you only enable stuff you need. For instance, if you have a desktop and it's not a wireless desktop, right? You physically have it plugged into the network. One of the things you can turn off is the wireless configuration agent, right? Because the more services that you turn off, it reduces your attack vector of that system. What happens if you've got the Windows wireless configuration service enabled? Maybe it has wireless hardware, maybe it doesn't, and there's a remote exploitability to that service, right? If it's not running, you're not vulnerable. So only enable stuff that you need. You need to strike a balance, right? The system has to be usable. You can certainly secure the box to where it's highly unlikely that it would be exploitable remotely from the network. But then the more barriers you put up to clinical workflow, users will find workarounds, essentially reducing the security posture of what you've done. So there is a need to strike a balance, but just know that there's likely things that you can do, and I can guarantee you there are things you can do that you can help secure the system without impacting clinical workflow. Real problem, staying secure. Change control is very important. It needs to be purposeful and the process strengthening, meaning don't do change control as a means of tracking what your IT staff are doing, right? Because we trust them, that's why we hire them. But when you have more than one IT professional, knowing what changes are going on and the impacts that might make across the enterprise is very important. And there are certain systems that are so sensitive that need to be highly available, that the changes to that environment, changes to your EHR, changing to your billing environment, changes to your pharmacy system, those changes should be scrutinized. The process may be very easy, but it should be more than just a decision shouldn't be made on a whim, is the point I want to make. And having those changes logged so that 2 weeks from now, if a system that isn't heavily used starts to misbehave or has issues, you can go back to a change log and say, okay, what did we do to this system in the last month? And oh, George manipulated this attribute. What happens if we reverse that? Does it solve our problem? So change control processes, generally in a more robust environment, you would have testing procedures. You would have implementation plans, right? So if you're going to do something that's going to require that the system becomes unavailable to end users, you certainly probably need to schedule some downtime. Do you do that during normal office hours? Do you do that after hours? Do you have rollback procedures? So if the change breaks something, can you quickly roll that change back, or does it require significant configuration to get the system back to the state where it was previously working? Communication is key. Communication is probably one of the most important things. Communicate to your stakeholders, right? If you've got to make a change to a system and there's potential downtime required, let your user base know. Let them know ahead of time. Let them know, if the change is taking longer than anticipated. So mid-change communication, and then post-change communication. Let them know the change has been made. These are what you should be, the expected differences you should see. In some cases, a change will be completely transparent, and you can just communicate the change has been applied, the system's working as expected, but if you notice anything, please let us know, kind of message. What's key to making your change control process flow smoothly is to define what are operational changes that don't need formal processes and approval. For instance, if giving someone access to a file share that is generally given to everyone within their role, if that's a standard process, that might be something that we can make that change within Active Directory, and we don't have to get a committee, or we don't have to get consensus on that change request, because it's a standard process. It's something we do on a very regular basis. It's a very low risk change. And then maybe having a tiered approach, so what changes absolutely have to be reviewed by more than the person making the change. In order to walk, doing an efficient job of endpoint security is a must. And these things deal with IPS, so the intrusion prevention system on the host, running firewall services on the host, running antivirus services on the host, right? Any one of these things are good. They're not great, but if we combine them together, they can be quite effective. Most of these things are like a flu shot. They only help you protect against known threats. AV antivirus is only effective about 25% of the time. So what's going on the other 75% of the time? You've got to have a good handle on how we're protecting these endpoints. All of these systems can generate a great deal of data, right? There's alerts, there's potential infections, we've quarantined, we've cleaned up. An organization that is walking is managing this environment, right? So they're getting all of the alerts from their antivirus. They're getting any suspicious or high-level alerts from the host-based firewall, or they're taking the logs from these environments and they're correlating them. Communicate to users when infections are detected, right? So if your organization is experiencing the configure worm, which compromised systems because of a missing Microsoft patch back in 2009, and the configure worm is still very rampant on a lot of networks, communicate to users. We're seeing this activity. This is typically how it spreads. This is typically how an infection occurs. So, be cautious when you're doing these kinds of behaviors.
Now that we've mastered crawling and walking, let's dig into learning to run.
The difference between running and walking is that we're becoming more proactive in our security defenses. And how do we do that? We implement more technology layers, right? We implement strong authentication. We implement network access controls. We use application whitelisting and blacklisting techniques, incorporating advanced security event management into all of our alerting systems. And then we use data encryption effectively. In order to run, you have to have a process for constant improvement, right? It's an endless life cycle of security. And then once you've ended it, you start the life cycle over. So let's get into the details. Strong authentication. What is it? Right? It typically means using more than one factor. If you're in an environment that is still using passwords and may not have a very strong password system, meaning that you force password changes, that you have stringent password requirements on the length and the complexity, that you require that passwords be kept for so long before they can be changed so that folks just don't cycle through them immediately to get back to their favorite password. Two-factor or multi-factor should be your goal, right? Passwords had a time and place in IT security, but that time and place has expired. Think about two-factor, particularly in places where you're accessing a trusted zone from an untrusted zone. So remote access, Citrix, VPN, all of these remote access mechanisms should have a two-factor authentication mechanism. Privileged account management. So think of all the accounts and all the credentials needed in order to maintain the environment. We have OEM or default administrative accounts everywhere. We have service level accounts, accounts and credentials that are used to back up our systems, are used to perform our patch management and our credentialed vulnerability scans that we implemented while we were walking. But how do we manage all of these privileged accounts, right? Do they have the same robust, strong authentication mechanisms for our end users? Do they use two-factor? Well, no, because these things are automated. These are infrastructure, these are utility accounts that have to run in the background, but we need to know about them, particularly if you have significant turnover in your IT staff, because those passwords have to change. They should be strong. Default admin accounts, service accounts, special user accounts, they should all be monitored, tracked, and in some cases require two operator approval for uses. So, for instance, your Active Directory enterprise admin, right, to make major schema changes to your Active Directory, that kind of change should not be done lightly, and perhaps access to the password requiring that level of change, maybe that flows into your change control password, and whoever the custodian is of that password, before they give it to the IT professional or the IT professional team that's going to be making these changes, they have to document the change control process, rollout, backout procedures, those kinds of things. Access control, network access control. Not easy to do, but essentially the goal is to prevent bad things from getting onto the network in the first place. So think about it. You manage all your equipment. At some point, IT has touched it before it was put into production mode, right? So we know the attributes of the environment. We should be able to restrict access to the network from anything that's not managed. So think about it. When you're developing trusted zones, anything in that trusted zone should have been authorized at some point to be on the network. So if bad things happen, segment into different network. Again, going back to our crawling stage where we start to carve out and segment, isolate our network. If a physician were to come in and he's been on sabbatical, he's got his laptop, it's been outside of the reach of your patch management system for a while, it's been out of reach of antivirus updating for a while, he plugs in, the network access control mechanism says, oh, this system has a virus. and it does not have the latest security patches that we require as an organization. You may not necessarily kick him off the network, but maybe you quarantine him into a remediation network so that he can, get patched, so he can get his system updated while still doing some low-level tasks. Control new systems and software to avoid surprises. Right? Again, if someone comes in with a device, whether this is the vendor, and if your standard was you have to have an antivirus or you have to have the firewall running, the NAC system will probe that device and determine whether or not it has those software controls that you require. Application whitelisting. Yep, it's one of the hardest things you can do. But I will guarantee if you get to the point where you know what all your authorized applications are, you will be a much secure environment. Why? Because malware basically is ineffective because it won't be one of your authorized applications. Right? Your patch management system becomes easier to deal with because you know all the authorized applications, so you know what needs to be patched and what doesn't need to be patched. If it's not authorized, it shouldn't be installed on your system. If it's not on your system, you don't have to worry about patching it. In order for this to work effectively, right, it goes back to that inventory stage. You need to know your systems, you need to know your application, you need to know what your systems and your end users need, right? You need to know what the application functionality is. This is one of the things that makes it difficult, because if you don't authorize an application and an end user needs it, it won't run. And then it becomes a help desk ticket. And again, security at that point is not an enabler. Security is, we're the computer police, and we're preventing people from getting their job done. So this takes a great deal of research. But once you have that initial list of applications defined, that ad hoc addition to it every time you get a new application is really not that much. The incremental work is much lighter than the initial work. Advanced security management, right? We have a lot of systems. We have a lot of data that our security systems generate. Think about it. We have firewall logs. We have antivirus logs. We have system administration logs from our Windows event logs, from our application logs, from our database. You may have EHR and clinical application auditing software. They all generate data. If you're going to run, you need to know how to effectively manage all that data. Right? Don't look at it in its silos. Right? If you're troubleshooting a security issue within a Windows environment, traditionally you would look in your Windows event logs. But there may be telltale signs from the firewall logs, from your intrusion detection logs, from your antivirus logs that will help support additional action items. So collect all your logs. It may be that you have a very short retention period on your logs. Right? If you have a robust infrastructure, lots of systems, lots of applications, perhaps you can only keep logs for 48 hours, after which they get overwritten. But if you're able to identify an issue and investigate within 48 hours, having every log can be a lifesaver. So and do stuff with them. So you're collecting all your logs. You collect them centrally. You can buy commercial solutions to do this, but there are a number of open source, or I don't want to say free, because even open source does require human resources to make them work. But there are open source solutions that will help you get to this point. But what do you do with the logs, right? You review them, or you set up automated alerts and reports to determine who's attacking me and how are they attacking me. Intrusion analysis and attack paths, right? So if people are attacking your systems via port 1433, typically used for Microsoft SQL, and you don't have any SQL databases, then the threat is somewhat reduced. But again, you want to understand why, and if there are means that you can do to prevent that. Find compromised hosts. So when you think about a botnet where you may have a host on the inside of your network trying to talk to a command and control server outside of the network on very odd ports or using particular packet patterns, you can look at that in the log. So if your firewall log says that you've got 3 hosts talking to this host in China using some odd ports or at odd times of the day, right? Those 3 hosts probably should be investigated. And then, of course, you can use it to detect behavior that requires action and take intervention to avoid compromise. So this could be, maybe a user is violating your acceptable use policy. And you wouldn't know this otherwise, but you are now collecting net flow data. So you're doing high-level analysis of network behaviors, and you know that, oh, this person is doing a lot of multimedia downloading at 2 in the morning. They're a night shifter. Is there something more productive they could be doing with their time? Perhaps. Data encryption. Next phase of learning how to run, and certainly one of the more difficult things to do. But in order to run, you need to be able to implement a public key infrastructure, right? This is where you would effectively assign a digital certificate to each one of your end users. And you could use those certificates for a variety of different functions. You can use it to associate to your secure administrative wireless network. You could use it for endpoint authentication, right? So you put that certificate on a smart card. In order to access certain components of the network, maybe you have to have your smart card. Remote access, email communications, anything where you're if you're signing documents, having a robust public key infrastructure is key to getting your organization to the next tier of HIPAA security. So what do you do when you have encryption and you have a public key infrastructure, right? Think about your private virtual database, or you have an EHR. There's likely sections in the EHR that only a select few need to really see that data. For instance, we collect social security number on a lot of our patients. Who actually needs to see the social security number? And if it's only a select people, use encryption or data masking in order to restrict that, right? So maybe your typical clinical worker can see the last 4, or however many of the digits that you would typically use for identification and verification processes. But then maybe your billing or your collections staff need to see the entire SSN. So use data masking, data encryption on backup media. This is a very important component of using encryption, because typically data backup media is stored offsite. So to support your disaster recovery processes, we prevent that data from being destroyed in the event of a fire or a tornado or an earthquake. But it leaves our premises, it leaves our control. We see in the headlines that backup media fall off trucks. They get lost by our vendors. If they're encrypted, less of an issue. Yes, you still have the potential of problems during data restoration periods, but at least the data is safe. Constant improvement. This is particularly with incident response and training and testing. All right, so we have advanced security event management and monitoring. So we're getting all these events. We know what kind of intrusions that we're protecting ourselves. We're finding compromised hosts. What do we do with it all, right? Incident response, testing, and training. Once you know what a common attack vector is, train on it. How do you intervene and respond to an incident? Disaster recovery testing. You may have a process that says we do backups. We do daily backups. We do weekly fulls, and we retain those for certain periods of time. But have you ever tested restoring from your backup media? Have you ever actually tested reverting to your cold site, or maybe you have a backup application somewhere that you can roll over to, but you've never tested it because there's never either been a need or you're unsure of whether it's going to roll over correctly, and of course you just can't deal with that outage at the moment. When compromise happens, right, continuous improvement, you need to understand how and why it happened. If it's a desktop issue, build a new image. But in this new image, make sure you've got the remediation steps inputted so that when you can roll that image out as quickly as you can to the affected part of your network. If it's a issue with a policy or procedure, make sure that you can update the policy and process, that you can get it communicated to your end users. If education material needs to be updated, again, that's an improvement cycle. You get it in front of the stakeholders so they can buy off on the update so that you can get it out to the end users. Or if it's purely an IT security control, a back-end mechanism that end users are completely transparent of, they don't know that this is happening, but in order to maintain robust security, maybe your firewall module needs something. Maybe it needs a hardware upgrade, maybe it's a software tweak, maybe it's you're going to implement it differently so that you can protect more segments of your network. Again, constant improvement. Don't think that once it's deployed, you can forget about it, right? You have to. These are like children. You have to constantly watch them. Before you can crawl, before you can walk, and certainly before you can run, there are some initial steps that every organization needs to take, right? These steps have to happen to be HIPAA compliant, but it also means that you are a champion of IT security. And the first is you have to assign an information security officer. And depending on the complexity of your organization, this could be a shared role, right? It could be, maybe the IT director is also the security officer. If you have a more robust or more complicated environment, it's highly recommended to have a dedicated person that their role is to do nothing but security. Key point is you need to give this person or persons the authority, time, and human resources to champion change. Security is not easy to enable in an organization, and if this role is given to the wrong person or the person's not given the authority, then essentially it's just a compliancy checkbox, and you'll never mature to the later stages. Another HIPAA requirement, but obviously a good business practice, is you need to conduct a security risk analysis to identify the problematic areas. And this should be done often. Often could be continuous. So as you implement new projects, new software, new initiatives, it should be security assessed for threats to PHI. Or maybe you take a more holistic approach and you do it every year and a half, and you look at everything. Right, and then you work on the remediation plan for that year until your next spot in time where you do another full assessment. But you also need to conduct a security skills gap analysis, right? We've assigned a security professional, or at least a person who is accountable for IT security at the organization. And that person either going to conduct or he's going to lead, he's going to be the liaison for the security risk analysis to be conducted. And you will find problematic areas that you need to work on. But do you have human resources within your organization to actually remediate those items, right? Is this something that you need to outsource to your vendor? Is this something that you go out and you seek a trusted partner? Is this something that you maybe fill internally, you open a position?
Thank you for joining me today in the webinar, How to Build a HIPAA Security Program. I have presented a great deal of information to you today. And by any means, if you have any questions, feel free to contact me directly. My name is George Bailey, Senior Advisor, Purdue Healthcare Advisors.